Hi, my name is Raanan, and today I will be doing a presentation on telehealth services and its integration with mental health. An introduction to telehealth. So, these services significantly increased after the COVID-19 pandemic. It is a digital way of delivering health care to patients, and it's a very fast growing market. It has multiple benefits such as medication management, reaching out to people in rural areas, and increasing access to healthcare, especially in underserved areas. It also offered significant benefits for mental health patients, especially during the COVID 19 pandemic when they had to make accommodations, and it helped out with provider shortages as well, which resulted in increased patient satisfaction. There's currently four different categories in telehealth. This includes synchronous, asynchronous, remote monitoring, and mobile health, which we will get into further in the presentation. The key concepts of telehealth services. So, one of the important concepts is that its services are to improve the population health. It also strives to improve healthcare outcomes while improving healthcare disparities as well. It wants to improve patient outcomes through experience, providing more convenience and increasing patient satisfaction. Telehealth also wants to provide a practical application for patients to save time and money due to travel costs and improve patient privacy, especially in the mental health industry. That's a big one. And allow patients to have comfortable visit in the home setting. Telehealth also allows easier outreach for patients in remote areas who have difficulty with transportation or who do not have medical access in that area. They may not have mental health care services. And it improves schedule flexibility, and this actually helps providers and the patients. Some of the benefits of telehealth services include safety. It prevents infection exposure as it did see its rise during the COVID 19 pandemic. It's well utilized for simple, non complicated follow up visits such as medication managements, check in appointments, and this is very practical for PMHNPs and mental health providers. It's also seen as a good resource to improve collaborative care between physicians due to the ability to exchange digital information and communicate with each other. It provides the opportunity for remote monitoring and mobile health services, and these are industries that are growing very rapidly, which can include apps, sleep monitoring, heart rate monitoring. And finally, telehealth services also give the opportunity to provide culturally competent care. Patients who speak different languages and come from different ethnic background may find access to better services that accommodate their cultural needs as well. It's also important to discuss some of the risk factors with telehealth services, even though the benefits are great. Telehealth services does have an increased risk of data breaches and privacy breaches and HIPAA violations. It's may not be encouraged for the high risk patients who may not be medication compliant or more in an acute phase. It's currently growing, so the service is expanding, and there's a lot of telehealth services out there that do not have FDA approval and have not undergone clinical trials. This is especially true for mobile health apps. And this may deter patients from seeking professional help if they're able to monitor themselves with a remote app. Some of the mental health benefits for telehealth that comes with telehealth, it allows the continuity of care. Examples of this among children and adolescents who need appointments during summer breaks. It's a lot easier for them to schedule it with telehealth services, or during a crisis when things close down, such as what happened with the COVID-19 pandemic. Enhances flexible scheduling, and this is again useful for kids who attend school. Some providers are willing to work outside of business hours and see patients. It also offers the ability to monitor patients for environmental safety. It's a big one for kids. You could see neglect and abuse in the home setting that a provider may catch. Mobile health is also enhancing research for various apps and different ways to improve healthcare in various avenues that we've not done in the past. And it allows privacy and comfort, and this is especially big for mental health because it really provides that therapeutic engagement for patients, and some patients, they just don't feel comfortable going into the office setting given the nature of mental health and some of the conditions that come with it, and the sensitive topics that patients have to discuss as well. So telehealth competencies basically states that because this industry is now being utilized professionally and is being billed, providers should be educated on how to utilize it efficiently. Um, the importance of it is providers need to evaluate patient safety and their ability to receive care with telehealth services. This can include patient literacy, their skill level to use a telehealth device or a digital device, and the provider's ability to identify unstable patients. Providers have to continue to provide professional communications with patients and family members via telehealth that meets standard guidelines such as building rapport, enhancing therapeutic communication. Providers should also know how to assess patients appropriately via telehealth and gather the pertinent data they need in order to create treatment plans. Telehealth competencies are also currently increasing because of its rapid integration into healthcare. Um, the service needs to be treated like any other medical care service. Providers must understand potential complications, side effects, research and validity of specific devices, and commonly used products. Some of this really falls well into mobile health. It's also important to understand regulatory policies and reimbursement prior to utilizing these services because this can vary depending on the state that you live in. And providers also have to understand the risks that come with utilizing telehealth services, such as potential breaches and patient data. Next, we're going to discuss the 4 different types of telehealth services currently available. The first one is called synchronous telehealth, and this represents the classic face-to-face provider-patient encounter, but this time it's in a digital setting. In addition to this, it can also include something termed as a facilitated virtual visit, where the objective data is either gathered by a nurse or another healthcare worker and then is given to the provider, and the provider does the virtual visit after he gets the data. There are specific regulations that are determined by the state for synchronous services, but this is accepted very well throughout the United States, and it is eligible for reimbursement, but reimbursements can vary depending on the state, and the regulations also vary by the state. Like, some states may require an initial in-person visit, and some may have limitations based on the distance that the patient is from the provider. Next, we have asynchronous services. This is basically a transfer of data either between providers or other healthcare professionals, which can include images, labs, or other pertinent medical information. It helps direct specific patient data to a specialist, and it can enhance collaborative care. Asynchronous telehealth can also be utilized for secure messaging between patients and providers. Um, this use helps promote health maintenance, appointment reminders, increasing medication adherence, and reminding patients to utilize their services. The third delivery service is called remote patient monitoring. So remote patient monitoring is very rapidly growing and allows patients to be monitored from a distance. Monitoring can include video monitoring of the patient or utilizing devices to monitor certain aspects of their health. Examples of this can include cardiac monitoring, and this can allow providers to identify arrhythmias and see the patient sooner. Most of these devices are FDA approved, like they have pulmonary artery tracking, and they have demonstrated positive results in preventative care for patients. Um, what's important here is that the medical information obtained from the devices is directly sent to the provider, and there is better regulation compared to mobile health in this specific delivery service. So the fourth delivery service is called mobile health. It's different from remote patient monitoring, and it's a broad term that is generally used for a variety of apps that could be on a smartphone or some kind of digital device where the patients monitor their own health. This can include heart rate, physical movement, sleep, and there is no limitation as to what people can create. This industry is rapidly growing, and it does have a large private sector. It does allow patients to track components of their own health, and this industry is currently the least regulated. But despite that, it's emerging, and it does not have extensive clinical research and is not validated, as well as remote patient monitoring. So providers may be hesitant to work with patients who do utilize some of these apps due to the lack of FDA regulation. So mobile health and mental health. There are mobile health apps available for mental health services. Sleep apps are a good example of this. And obviously, this is far more complex than just monitoring heart rate because sleep is a complex process and can be monitored in various ways. There was a research study that went over 50 sleep apps and evaluated them based on something called behavioral change techniques, BCTs, and the mobile app rating scale, MARS. So there are some standardized tools that are being developed in order to rate apps. The researchers did conclude that these apps were a resourceful tool for providers, and most of the apps really just track how well the patients were practicing relaxation techniques, and they help patients track their sleep wake schedules. There was another study for an individual case who didn't have psychiatric access nearby but did experience some positive outcomes for an app that helped him track behavioral therapy. He did have to pay $10 for this app, but it was useful for in this particular case study. Um, so some of these apps may be convenient to improve access and augment treatment, but it's also important for providers to consider safety and regulation when managing these patients who are using various apps. In conclusion, with telehealth emerging as such a huge market in various avenues, patient safety should always come first and be the priority for providers. Providers are here to determine the risk versus benefits for specific services and the utilization of specific devices. Um, Given the current growing rate of these mobile health apps, it's very likely that mental health providers are going to begin to encounter them quite frequently in the clinical setting because patients will be utilizing them, so it's not something that providers can avoid. But providers should yield caution and follow regulatory guidelines for clinically tested and approved telehealth services. Mobile health is currently demonstrating significant breakthroughs and seems promising, but also providers should consider that if patients have the ability to choose over 50 apps just for sleep alone that have different features and tracking services, how complex all these apps can be, and that the sophistication of them is only going to continue to grow within the healthcare industry. So, therefore, it's up to providers to work safely with patients and enhance treatment outcomes. This concludes my presentation, and I have a list of the references that I used for the presentation. I do hope that you found this presentation to be useful for a telehealth application and understanding its implications in mental health care. Thank you.